what she did was just so brave, and did so much for Indigenous people.
With the 2-year anniversary of Joyce Echaquan's death, many in the medical community continue to call out racism and reflect on the Atikamekw woman's final moments. Echaquan live-streamed as Quebec health workers hurled racist slurs at her as she lay dying in a Joliette Hospital northeast of Montreal. She died September 28, 2020.
Joyce had a lot of courage, a lot of strength, and I honor and respect her memory. For doing that, because for me, I would describe what she did as a bolt of lightning that just shed light to what we've known for a very, very long time and what we've lived through and what we've experienced.
I remember seeing that video the day, when she died, and I was shocked, as is the rest of the world. And I thought, wow, how could she have suffered so much when she didn't get the care she deserved? And this happens fairly often, and many Indigenous people have faced racism in the healthcare system.
A 2021 Quebec coroner's report said Echaquan would likely still be alive if she were a white woman, that systemic racism contributed to her death.
As a nurse at that time, I was ashamed to be even associated with the nursing profession. I was ashamed to be a nurse. I felt for her. I felt for her family, her children. As a mother myself and now a grandmother, it really affected me very deeply. She helped me find my voice in speaking out against what I've seen in my almost 20-year career as a nurse. And I think, right now, there is a lot of work to be done, and I'm doing what I can.
Indigenous healthcare workers say not enough significant change has happened to keep Indigenous patients safe.
It starts with learning about this knowledge. What's it like in the communities? What are the social determinants of health that affect them? For example, housing, gender issues, education, and culture. Culture is a good social determinant of health. The training that's recently been offered in Quebec, I believe has not been well done. I've done the training, and as an Indigenous health professional, there are a lot of gaps in that training.
In Montreal, Brittany Henriques, City News.